Hi, I'm Dr. Reed. If we haven't met yet, I'm the medical director here at Seattle Humane, and I'd like to share some information with you about kennel cough so that you can better understand our infectious disease policies and procedures, and so that you can help us to continue to provide excellent care to our dogs. The term kennel cough is commonly used to describe upper respiratory infection symptoms in dogs, but this term is overly simple. In actuality, kennel cough symptoms can be caused by at least 10 different infectious agents, and one sick dog may actually be infected with a number of different respiratory pathogens at the same time. For this reason, it's more accurate to call kennel cough canine infectious respiratory disease complex, even though that's a mouthful. The clinical signs of canine infectious respiratory disease can vary significantly, but the most common symptoms we see are coughing, sneezing, and discharge from the eyes and nose. Some dogs may also appear lethargic, have a decreased appetite, and may develop fevers. Infectious respiratory diseases in dogs can be complicated for a number of reasons. Since the symptoms are similar between many canine respiratory diseases, you can't tell by looking at a dog what it is infected with. A dog with mild Bordetella infection might look just as sick as a dog infected with distemper virus. But while Bordetella usually causes pretty mild, treatable disease, distemper virus is a much more serious problem and can lead to outbreaks and even death. The severity of clinical signs does not always reflect the severity of disease or the infectious potential of the disease. One might think that a dog with a loud cough and a lot of nasal discharge is more sick than a dog with a quiet cough and no discharge, but this is not always the case. Mild upper respiratory infections can progress to more severe pneumonia very quickly, and sometimes the only indication you have is that some of the symptoms, like cough and discharge, appear less severe. For this reason, it's important not to make assumptions about how sick an animal is based on how it looks, and report any changes in their condition to medical staff. Kennel cough can spread through aerosols in the air from coughs or sneezes, directly from dog to dog through nose to nose contact, or through germs on contaminated items. Most pathogens involved in canine infectious respiratory diseases are not very hardy in the environment and are easily killed by drying or disinfection. Therefore, it is very important to disinfect items, areas, and hands between dogs. A fomite is any object that can be contaminated with infectious organisms and can serve in their transmission. In our shelter, every surface and every person is a potential fomite. Don't be a fomite. Here are some commonly encountered examples of fomites you might see in our shelter. Things like toys, cleaning supplies, Kongs, people, their scarves, their clothes, caranda beds, leashes, and even door handles can be fomites. We need to be super vigilant about cleaning and disinfecting all areas that come in contact with animals, whether they appear to be sick or not. There are numerous factors that make some animals more susceptible to developing an infection than others. Increased susceptibility is related to the ability of an individual dog's immune system to fight off disease. Age is an important risk factor for infectious disease. Due to undeveloped immune systems and incomplete vaccinations, puppies are always our highest risk population. For that reason, we always take extra precautions with puppies in our shelter, like wearing gowns and gloves to protect them. Senior dogs or dogs with other medical conditions or illnesses can also have compromised immune systems that make them more susceptible. Many animals that come into our care at Seattle Humane have not had the benefits of regular veterinary care, and as such do not have any immunity against many common diseases. Although we do vaccinate all animals immediately upon arrival to our shelter, it takes time before the vaccine is effective. It may not seem obvious, but another major risk factor for kennel cough in a shelter environment is stress. Just as students tend to get sick around exam time due to being run down, tired, and around a lot of other students, dogs in shelters experience a high level of stress that compromises their ability to fight off infections. Another factor that makes canine respiratory infections complicated to manage is that dogs that appear healthy can actually be infected and spreading germs to other dogs at the very beginning of their infection before they're showing any clinical signs, and also at the end of their infections when they appear to be fully recovered. This is the reason that dogs recovering from respiratory infections at our shelter are not allowed to join play groups for 14 days after they're released from kennel cough treatment. At Seattle Humane, we focus a lot of time and energy on preventing the spread of infectious disease every day. In the following slides, I will talk more about each of these ways you as volunteers can help us keep our dogs healthy. As I've already discussed, stress plays a major role in susceptibility to infections. Even the best shelters are inherently stressful environments for animals, so every step we can take to reduce stress for our shelter pets is crucial. A relaxed dog is not only less susceptible to getting sick, but it's also a dog that's more likely to show well on the adoptions floor, get adopted, and have a shorter length of stay. Here's a list of things we try to provide to our dogs to reduce their stress on campus. If you're not already participating in these stress reduction techniques, or if you have other suggestions, please chat with our animal care team, the behavior team, or our veterinary services team. Cleaning is obviously super important in helping to curb the spread of infectious disease in our shelter, but how we clean matters more than you might think. Be sure to follow Seattle Humane's SOPs about cleaning and disinfection. And here are a few extra reminders. Since the cleaning process can be stressful and disruptive to pets, try to remember to spot clean when possible. If the kennel, bedding, etc. aren't dirty, they don't need to be changed. Don't forget that disinfectants don't work until the organic matter, things like urine, feces, food, and snot, have been fully removed. Finally, if you're handling multiple dogs or cleaning in multiple areas, remember to always handle healthy animals before sick ones and puppies while wearing PPE before adults. I've mentioned PPE a few times, so let's get into it. PPE stands for Personal Protective Equipment. For dogs with kennel cough, required PPE is coveralls, either fabric or Tyvek, gloves, boots, rubber boots, or shoe covers. Since when we interact with dogs, our legs and feet usually come into direct contact with dogs, gowns alone are not sufficient. As previously discussed, not all dogs that have kennel cough symptoms are infected with the same diseases. In our shelter, we often have dogs who have come from many different places, so we need to take care not to mix infections. Always wear appropriate PPE when handling a sick dog and change PPE between individuals. Here's the PPE signage you will see around Seattle Humane. If you can't find what you need to interact with sick dogs, please ask an animal care or veterinary services staff member. Housing and isolation practices can make a big difference in preventing the spread of infectious diseases in an animal shelter. Since puppies are our highest risk population, we always aim to house puppies and adults separately. Similarly, we always isolate sick dogs from healthy dogs as soon as possible. If you notice symptoms of kennel cough in a dog who isn't already isolated, please refrain from allowing that dog to interact with other dogs, wear PPE, and alert a staff member. Sometimes we have dogs with mild symptoms who are otherwise ready for adoption. These dogs may be on the adoption floor, but all normal kennel cough procedures and precautions should still be observed, such as wearing PPE, dogs not being in play groups, etc. Finally, since we transfer dogs in from many different shelters across the country, we house dogs in holding areas according to their point of origin to avoid introducing new diseases to new populations. And when they become sick, we isolate them according to their origins as well. Some dogs infected with respiratory disease are able to clear the infections on their own without treatment. In shelters, we typically treat kennel cough with supportive care and antibiotics. If you're working with sick dogs at Seattle Humane, please take some extra time to provide them with TLC in order to speed their recovery. If you spend time working with sick dogs at the shelter, provided that you always wear PPE as directed, the risk to your dogs at home is extremely low. Presumably, your pets at home are healthy, well vaccinated, and not super stressed out. If you happen to have more susceptible dogs at home, like puppies, seniors, or dogs that are not well vaccinated, You should take extra care. As discussed in an earlier slide, some dogs who appear healthy may actually be infectious either early or late in the disease. For this reason, it's always a good idea to promptly change out of your shelter clothes and shoes when you get home in order to prevent the inadvertent spread of disease to your own pets. Since supportive care and stress reduction are cornerstones in helping our kennel cough dogs recover, getting out of the shelter is really important. For dogs that have kennel cough and who aren't adoption ready, this is where foster can make a really big difference. If you have dogs at home, you can still foster a dog with kennel cough. Here are some steps you can take to help keep your own pets and the public safe. Make sure your pets are up to date on vaccines. That's the DHPP and Bordetella. Try keeping your kennel cough dog separate from your resident dog if possible. Don't bring kennel cough foster dogs out in public until at least 14 days after their clinical signs are resolved. Thank you for generously volunteering your time to help out our shelter animals. We couldn't do what we do every day if it wasn't for your help and support. I hope that you found this helpful. If you have any questions or concerns or suggestions, please don't hesitate to reach out to me directly. Thanks so much. Bye.